Well, your arch, your foot normally has an arch where you actually have this convex shape to the foot, and this actually provides support to the bones to the midfoot. When the tendon, specifically your posterior tibial tendon, which runs right through here through the middle of your foot, is not working, your foot will become collapsed. And I have a model here which will show you that exact scenario where this entire area is flat and there is no longer the normal support and biomechanics of the foot that should be there. Flat feet are caused by two things. Number one, it can cause from congenital reasons, meaning that you're born with them, and this is very common, yet most people don't have any symptoms. Oftentimes that can be treated with simple arch support or nothing at all. As we get older, and there's something called an acquired flat foot, a flat foot that develops with time and age, and that's caused by a dysfunction of your posterior tibial tendon, which attaches here on the middle part of your foot. If that tendon is not working correctly, then the ligaments, which actually help to support and give you an arch, actually starts to break down and your foot becomes flat. Well, first and foremost, you have to determine if your pain is actually from flat feet or if it's from some other cause. In Next Step Orthopedics, we work hard to ensure and to determine the cause of your flat feet. A bunion is a term which gets a lot of coverage among lay people. A bunion is really the bump on the inside of the foot. Hallux valgus is the real deformity that people refer to when they talk about bunions, where the great toe or the big toe is misaligned. The top three symptoms associated with bunions that should be treated are pain, pain, pain. Pain is the number one and only reason why people should have bunion surgery. There are definitely things that contribute to that pain, which include tight shoe wear and essentially wearing shoes that are not comfortable. There are two main reasons why people get bunions. Number one is wearing tight shoes, like I mentioned before. The second reason is genetics. Oftentimes bunions run in families. Grandma has them, mom has them, and the daughter may have them as well. Men do get them, but not as commonly as women, primarily because they're not wearing shoes which are so tight. Well, the main thing to do to relieve pain from bunions is to wear comfortable shoes, usually a shoe that has enough space for all the toes. If you have to stuff your foot into the shoe, that's probably not the right shoe. This is challenging, especially for women, because their high heels oftentimes don't conform to their actual foot size. So that tends to be the main thing you can do to treat bunions. Like I said, shoes with enough space. And this is not going to be attractive, but clogs and open-toe shoes, flip-flops, these type of things tend to be better because they're not putting as much pressure on the outside of the foot. Runner's toe is a traumatic injury to the toe from running, as the name implies. Usually the toenail develops blood underneath the toe from being impacted with repetitive running. You may notice that there is some blood, some discolored blood or hematoma underneath of the nail itself. The nail may even lift off or split. There's a whole spectrum of ways that it could present because of just that repeat trauma. The main way to prevent runner's toe is by wearing appropriate fitting shoes and socks. If you wear a shoe that is either too big or too small, that may allow your foot to experience pressure that it's not supposed to experience, which may cause the runner's toe itself. And also running without a sock on may further traumatize the toe.